for each individual?
So part of what we do is put together a student action plan, which is sort of a survey for the student to fill out and work with us, just speaking to their strengths, things they feel like they could improve, challenges they've had in the past, so we know who we're working with. And also for the family to fill out a family action plan, asking them, what type of goals do they want to work towards for their family and for their student, and what do they wish to see in the future, and sort of putting in place steps, small steps that we can take to get them to their ultimate goal. So it's definitely individualized for each student.
And do you feel that they do open up to you and give you sort of confidence in what you have to offer them?
Absolutely. So I definitely have families who the first time I meet them, they're a little closed off and guarded, and that could be due to just sort of being shy in the first meeting or having to have gone through other resources that weren't so, kind and forthcoming with information. So, and I run the gamut of families who will tell you their life story when you first meet them, which is perfect. They make you feel part of the family, and that's really excellent. I love that. I enjoy that part of the job.
So they do appreciate having somebody there who can actually help and develop a plan for them to accomplish certain goals that they seek.
Definitely. The support is always appreciated. Sometimes you have an end goal that you want to reach, but you're not too sure how you're going to get there, and you're not always able to lay out the steps, or maybe financially you're not as able to help your child maybe apply for college, and we can take that weight off of them and provide the assistance with application fees or bringing them to visit colleges. They definitely appreciate that.
Do you feel that from students these days, their academic barriers, what's expected of the student, plus with the sort of the social impact and the peer pressure that they have, how do they overcome that? How do they become an individual and really want to strive for that goal?
So I believe that our students come to us wanting the same type of education and structure and rigor in the classroom that every other student would want at, say, Stanford High or West Hill High School in Stanford. But sometimes there's barriers in their way so that it's not always an easy path for them to get to.
Do you feel that they may fall into sort of the wrong crowd or follow the wrong path?
Sure.
Peer pressure?
Sure, peer pressure. They don't always have the proper role model in the home. Didn't always grow up with mom and dad in the house to sort of give them the right values and morals, and we're there to help them with that.
I mean, one of the reasons I ask is something for medicine, for instance.
Mm-hmm.
If you're going to become a doctor, you need high school, obviously. Then you need 4 years college.
Mm-hmm.
Then you need 4 years medical school.
Right.
Then you need residency, which is anywhere between 3 to 5 years. Then if you're going to subspecialize, you have at least 1, 2, or 3 more years of that.
That's a lot.
As you're looking from the junior high or even high school level, that's a long road ahead of you that you have to be pretty determined to know that there is gratification, which is going to be down the line.
Definitely.
But you have to really veer up and understand that it will come.
Mm-hmm.
But there are certain hardships along the way while your friends, go out and get a job after high school or even after college while you're still in school and have expenses and not making money and need essentially loans and support to keep you going.
Right.
Especially with today's, economic status.
Mm-hmm.
I understand that you've also done a documentary not too long ago.
Yes.
Can you tell us a little bit of what it was about, what it entailed?
Sure. So I was part of a documentary called Education versus Incarceration, The Real Cost of Failing Our Kids. It aired on CPTV. And I worked with a student, Ipreya Walker, who she was filmed. And she has overcome so many barriers in her life, so proud of her. She just graduated high school in January, so she's walking this spring. She came from poverty in the home to having a child at a young age to experiencing incarceration and kind of getting herself back on track in school, where we were able to help her set goals that are reasonable and attainable and small enough so that she could see some sort of satisfaction and not get discouraged, to ultimately reach her goal of graduation, and now she's attending college.
Really?
So the program at the start had a startling statistic of, so for the first time in recent history, there's 5 states in the U.S. that spend more money on incarceration than they do on education, and Connecticut's one of them. So it's sort of focused on that trend that's threatening our state's future, the youth that are part of our state, and ultimately, globally, the world, because they need to go out there and be productive citizens And if they're not receiving a quality education that are preparing them for it, then what are we really setting them up to do? And how sort of is incarceration helping anyone, really? It doesn't produce productive members of society. People come out of there with a feeling of being held back, and they obviously don't have the same advantages as we do, with good education and support system.
So more money is actually being funneled to incarceration rather than education.
It is.
Where teachers are one of the most important things for all of us.
Mm-hmm. And education is just, I think, the pathway to success for people. And if they're cut off from that because they weren't given the resources and weren't lucky enough to have certain opportunities, they just get funneled toward the court system and then to jail and on, and there's no support. Even when you come out of jail, there's no support system for you to go to and sort of, get a job, learn how to reinvent yourself into the community. There's nothing.
So essentially you come out, you're on your own.
Right. And I feel like education, support from family or any type of group of people that you associate with that are productive and good for your health, and any type of prevention program for people is definitely beneficial, as opposed to funneling people to the penal system.
How are you able to fund these programs? Are they done at a federal level, a state level, or a county level?
So all different levels, federal, state, and county. And there's a group that does really good work, the Center for Children's Advocacy and the Connecticut Juvenile Justice Alliance, that do really great work in educating people about the risks of incarcerating our youth and sort of the impact of that on communities, families, and just the world as a whole.
Well, I think for what you do, it definitely requires a certain type of individual to do it. And I hold you with the utmost respect and honor for that, because
Thank you.
You have to be noble, you have to actually want to help the community, you have to be friendly, and you have to be very pleasant. And I think you're all of those
Thank
to
you.
begin with, but I think that makes the individual, and that's what gives that trust in the individual, just by talking to you, to say, I can trust you. You're there to help me, and I feel comfortable about what you have to offer me,
Right.
and what I need to do in order to make my life better.
Right.
I really think what you do and what's offered statewide is very helpful, and I do think there is a lot of barriers that are present there, again, from the financial to the social to the academic parts that can inhibit someone from striving and reaching their true goals. And especially with peer pressure, early pregnancies, drugs, and being associated with different groups, knowing that there is an out and somebody that's there that can show them there's a light at the end of the tunnel.
Definitely.
And there's a better life is very good. And I like for the audience to know that there is always help out there. And if you're really striving for it and you're searching for it, it's there. You just have to want to accept it, embrace it, and really want to have a better life for yourself. And I thank you for your time on that.
Thank you. You're welcome.
So social work is important. It's available throughout life, into the hospitals, in schools, in the communities. And it's always there to help. It's there to facilitate it for you, to make it better for you, and to provide you with options. Options is always a good thing to have, because you can choose where you want your life to be. So thank you very much.
Thank you.
Thank you for being with us. We'll come right back after these messages. Welcome back to Healthcare from the Hill. I hope you enjoyed our show. We spoke about Mr. Robert Howell, much beloved, first host of this show, who we'll remember and cherish forever. And this show is dedicated to him. We wouldn't be here without him and the love and support he's given to so many over so many years. I honor his memory. We have spoken to Juliet Bracchio, cheerleader with hyperflexibility and really an outstanding individual, and we wish her luck in her endeavors. We've had Christina Howell, who has instructed us on how much help is really out there and what's provided to each one of you, which can make an impact on your life and what you do, from the student level all the way to an adult. Happy Father's Day to all the fathers out there, since it is tomorrow. Have a good day, enjoy, and the words of Robert Howell, be healthy, listen to your doctor, do what is right, and you too shall live a healthy life. Thank you very much. Happy Father's Day and have a good day.